Hello friends. So today I'm going to describe about a patient whom I had recently managed, and it was a diagnostic challenge, but careful history and evaluation confirmed the diagnosis, and it was very useful for the patient also. So basically the history is that it was a 69-year-old gentleman who was waiting in a queue to board a plane, and while he was in the queue, he started kicking the lady who was standing in front of him. And the lady got upset. But when she turned around, she saw a gentleman who was much older in age to her. But still, she asked him, why are you getting so impatient? And then can't you wait for some more time? And anyway, boarding is going on. And just because you are much older in age to me, you can't take advantage of that. But the gentleman, he was shocked because he wasn't doing it intentionally. So he told her that the leg is not under his control and he didn't do it intentionally. However, that those symptoms did not repeat again, and he was able to board the plane. And then, but as soon as he reached Hyderabad, he was still concerned about those symptoms. So he met a general physician. And general physician listened to the history, and then after that, he told him that most likely you had a type of seizure, what is called as focal motor epilepsy, where only a part of body can shake for some time, and then it will be fine. So he started him on epilepsy anti-seizure medications, and then and sent him off. But in the next just about 3 to 4 weeks later, he again had repeat of the same movements. Again suddenly his right leg would start shaking and jerking, and that will go on at say 3 to 4 or even 5 times in a minute, and that would last for about 2 minutes or so. And this repeated in a period of 4 to 5 days, some 2 or 3 times. And despite taking this anti-seizure medications, this happened. So at this point he got worried and he consulted me. So I listened to the entire history. There's nothing else. He was totally normal, and except for these 4 or 5 times when he had shaking of his right leg without his control, which lasted for 2 minutes, there's no other problem with him. In his past history, yes, he was a smoker earlier, and he also had high blood pressure, and for which he was taking medications and they were under good control. But suddenly, it struck me that it could be something else and not focal seizures, especially with his age and other risk factors, and that is called as limb-shaking TIAs, or limb-shaking transient ischemic attacks. So basically, that is a sign of brain ischemia. The blood flow to the brain reduces, which commonly causes weakness or paralysis on one side, and that recovers in a few minutes. But in a small number of people, it can present with just shaking of the hand or the leg, and that typically lasts for 1 to 2 minutes. With that in mind, I got his brain scanning and something called as carotid doppler done. So his brain MRI was normal, but carotid doppler showed that his left carotid had about 80% stenosis, which is significant stenosis, and that needed to be treated. So basically, such significant blockage needs carotid revascularization with either what is called as putting a stent or endarterectomy. So he was referred for the procedure, and also I started him on blood thinners and statins to prevent strokes in the future. So basically, the message I want to give here is that the brain ischemia, which occurs due to lack of blood flow to a part of brain, can present with involuntary shaking of arm or leg, lasting for say 1 to 2 minutes. And in an older person who has risk factors for TIA or stroke, we should suspect transient ischemic attack, because proper evaluation and early treatment can prevent strokes in such a person. So I hope you enjoyed knowing about this case. And if you have any feedbacks or comments, I'll be happy to go through them. Thank you.